Welcome everyone to the Child Early and Forced Marriage Seminar Series. I'm delighted to welcome today Dr. Rachel Kidman, who will serve as the moderator.
And could you just please let me share the screen, if you could? Thank you. Great. So today we have Dr. Malhotra here from the UN University, where she is a visiting fellow. She has been doing research on gender equity for many years, focusing on women and girls' sexual reproductive rights, and specific today on child marriage and empowerment of adolescent girls. So she comes to us with a great deal of experience advancing gender equity. She's been a key player in shaping the global program to end child marriage at the UN, at UNICEF. She has advised for Girls Not Brides. She has convened researchers and practitioners and policymakers to look at the evidence base and really shape the agenda going forward on child marriage, which is why we invited her here today. So she's going to share her findings from a recent scoping review of the literature, and perhaps more importantly, I hope share her insights from the process and thoughts on how to move forward in the most effective way.
Thank you so much, Rachel. And Bai and Sushmita, thank you for inviting me again. Yeah, I'm sorry my co-author Shatha could not be here. She just had a baby 2 weeks ago. So I will be presenting today's seminar by myself. But some of you may remember Shatha and I presented a seminar on our recently published systematic review on the evidence based on child marriage. And in that seminar, we talked about the scoping review that we did, which is available on the UNICEF and UNFPA websites. You can download it from there. There's a very long report, and then there's an executive summary as well. And the reason we decided that it was worth doing a second seminar was that in our last meeting, we sort of went through the broader evidence base very quickly, and there were some, I think, important insights. And I hope that there can be a discussion based on the scoping review itself and what it means for the child marriage agenda. Next slide, please. So I think most of us would agree that in the last 20 years, we have gone from a period in 2000 when the term child marriage did not even exist, to 2011 when Girls Not Brides was formed, and by 2015, child marriage became a SDG target. And in 2020, we are now already 5 years into that SDG target. And that was one of the reasons for our doing a scoping review of the evidence to see sort of where we are. Next slide. If you look at, the evidence that's been published over the years, you look at this 2001 report, you can see it's still not even called child marriage, it's called early marriage. In 2003, my colleagues and I at ICRW did the first sort of reframing of the issue under the title Too Young to Wed, sort of a analysis of what it means to be married as a child. And still in 2005, it was still called early marriage. And if you look at the first report in which it's called child marriage, that was in 2006, when in about 2005, we started coining that word, and many of us started pushing it out as child marriage because we wanted people to understand it wasn't just talking about early marriage. We're talking about these are basically children, even if they're 17 or 16 getting married. Then in 2011, my colleagues and I published the Solutions to End Child Marriage paper, which actually framed some of the interventions you could undertake to end child marriage. And now we're looking at global reports and summaries coming out all the time and producing so much evidence on child marriage. Next slide. In particular, we're getting more data. You know that UNICEF in 2018 looked at published a trend report, which actually showed that child marriage rates are declining, which is a very encouraging sign. And many of us need to really think about what that means. They've gone down from, over 27% of girls getting married to 21% of girls get married. Not very many global indicators see that kind of a decline in 10, 15, 20-year periods. We need to see how we go on the trajectory of a faster decline than we currently have. Next slide. Similarly, if we look at the numbers, we used to talk about 700 million girls estimated as child brides. Now we talk about 650 million girls estimated as child brides. We look at the burden in South Asia versus Sub-Saharan Africa, which are the two regions with the highest rates of child marriage. And even though the rates are higher in Sub-Saharan Africa, the largest number of child brides are still in South Asia. But we know that the rates in South Asia are declining faster, and the population sizes in Sub-Saharan Africa are growing faster. So within a decade or so, you're going to see a shift in the burden on child marriage. And what does that mean? Next slide. And most importantly, and I think what's most scary is that on the one hand, we can celebrate the fact that there were 18 million more child marriages prevented in the last decade because of the accelerated progress we have made than before. We are not anywhere close to, if you look at the right side of the slide, we need to increase the rate of decline by multiple times, 10 to 12% times more than what we have been able to accomplish so far. And it's not clear that, in fact, we know that in the next 10 years, we're not going to meet the target that we have set for ourselves. Next slide. So we needed to do this evidence review to see so much progress has been made in the global agenda on child marriage. What is the action that now needs to be taken considering where we are? So much more research is being produced, and is it helping us to get where we want to be going? Next slide. So to sort of address this question, Shatha and I did this scoping review. We looked at all the studies that came up with new findings in the last 20 years that had a methodology that produced something new and gave us new information, and found 386 articles published, unpublished, in books, in the gray literature. And as you can see, that's a very, very substantial literature. And we can also see that we covered topics on the prevalence and measurement of child marriage, the determinants and correlates, which was a lot of people call drivers of child marriage, the consequences of child marriage, and then the interventions. And you can see there's sort of this bell curve on these topics. And I'm going to discuss some of them a little bit more in detail. Next slide. So first and foremost, on prevalence and measurement. So this is research on what are child marriage rates, how are they distributed across the globe, what are the trends, what indicator do we use to measure child marriage. There has been, as you can see, an explosion, especially since 2010 or 2012 or so. And most of the literature, if you see in the pie chart in green and blue, is in South Asia and Sub-Saharan Africa, and the two regions that have the highest rates. But in the last decade alone, less than a decade alone, we have had many times more literature published than in the previous 11 years or so. Next slide. And what does that literature tell us? So there's been huge progress on the prevalence and measurement literature. We have much more data on many more countries, more regions. We focus more on the rates and are very precise about it. And we look at the burden in trends. We also have now, we noticed in the literature, a robust and standardized measure, women married 20 through 24 before age 18. And that is being used much more as a standard measure, whereas previously people were using many different measures of child marriage. And we are starting to have more data on subnational rates and the difference between boys and girls and things like that. And so we're far, far ahead of where we used to be. What are some of the gaps and challenges? Well, we still need more subnational analysis for targeting action. We don't have good data for prevalence in humanitarian settings. Everybody thinks that rates are high in humanitarian settings, but that's not necessarily true, and it's not necessarily easy to measure because it's hard to go and collect data in those settings. We need to standardize how we measure trends. Different agencies measure trends over time using cohort data versus different cross-sectional data. And unfortunately, I worry a little bit about many modeling exercises that are out there that are based on assumptions that are not clarified. So for example, recently UNICEF published a report saying 30 million more girls could be married as children because of COVID. And on the one hand, we do need people to know the dangers of COVID for child marriage. There's no question about that. On the other hand, it's important to clarify that this is based on certain assumptions, a certain modeling exercise, which in this case, for example, is almost entirely due to the fact that we think that girls being kept out of school is going to accelerate that trend. I say that I worry about this because, as you know, that when you sometimes overplay the dangers of a situation, and if it doesn't happen, then the entire field loses credibility. And child marriage is a bad enough problem already that I'm not sure we need to be constantly arguing that it's getting worse when in many cases it is actually getting better. So we need to be very careful about how we present trends and assumption-based models. Next slide. On determinants, correlates, and context, the trend, as you can see, this is the topic that was covered the most often. The largest literature that we saw in the last 20 years was on drivers, what people call drivers of child marriage. And the reason we are not using that term is that many of the things that people consider to be drivers of child marriage, poverty, sexual control of girls, economic deprivation, social norms. There's a two-way relationship between child marriage and those things. They cause child marriage, but child marriage also causes all of those things. And so I think it makes more sense to call them determinant, correlates, and contexts. And as you can see that in the last 5 years alone, there were more studies published than the previous 15. And there's a huge and massive literature, especially on sub-Saharan Africa and South Asia, but also in the Middle East and other globally and other geographic regions. Next slide. And what's interesting is that there's also good variation in quantitative literature that's looking at the relationship between child marriage, education, socioeconomic status, rural urban status, and so forth, but also a very substantial qualitative literature talking about cultural traditions, sexual and gender norms, social pressure, legal systems, things like that. Next slide. What was, I think, very interesting for us was that even though the justification for a lot of this literature is that people want to understand what are the drivers of child marriage in their specific context, they think that the specific factors that are motivating child marriage where they live or the places where they are working are unique. In reality, actually, there is a lot of commonality that the literature tells us about what are the underlying factors for child marriage. And we would put them into basically three buckets. One is gender and sexuality, and it's the most widely cited factor underpinning child marriage almost everywhere. And it can be in many settings, the protection of girls' chastity or honor, but also in West African settings, for example, proving their fertility or legitimizing pregnancy, also in Latin America, for example, or it can be about transactional sex that girls are doing to make money and then it becomes a marital arrangement. But clearly, gender and sexuality is a very big driver of child marriage and vice versa. Gender and economics is another common underlying driver pretty much everywhere. 50% of the studies we looked at and 80% since 2011 cite gender and economics as a driver, and there are three paths. One is poverty, one less mouth to feed, especially in crises. People mention this. It could also be the reverse, which can be the status and wealth display that so rich people sometimes marry their daughters early because of that. And then there are marriage transactions, which are, having to pay dowries. Younger girls have lower dowries in many places, and then large bride prices are extracted in many African settings for younger girls. So gender and economics is a second factor. And then the third factor is gender roles and opportunities, and to the extent that girls and young women in particular are seen as having only motherhood and marriage or marital relationships as the only legitimate social role, versus when they have real opportunities for going to school, having opportunities to work and have other paths to adulthood. And we find that even when child marriage is chosen, quote unquote, by young people in runoff relationships and so forth, it's partially because girls themselves see as marriage as the only legitimate path to adulthood, whereas when you have other opportunities to become adult through schooling or on jobs, then child marriage is less prevalent. So this is underlying pretty much everywhere. These are the three factors. Next slide. So the progress on determinants and correlates has been that there are consistently confirmed correlates pretty much everywhere. Less educated girls from poorer households in rural areas get married early. We have a lot of nuance with primary data and mixed methods. We see over and over again that studies establish the importance of education and the negative relationship between education and child marriage, and especially secondary education. We have many more geographies and subpopulations for which we have data, and we're starting to have data on conflict and crisis, although, as I said, it's not as clear that there's that negative relationship, positive relationship between conflict and child marriage as people always think. It's not always the case. Next slide. But our biggest challenges are that there's huge redundancy. It's not clear that this many studies needed to be done. A lot of times people keep saying that they want to look at drivers because they want their programs to be very contextually driven and they want to tailor their programs to their context. But what we found was that people are finding, even when people find different drivers, they're doing the same programs. So it's not clear that doing research on drivers is helping people to frame better programs. The other big challenge still seems to be that people are focusing still on the individual and the household and not on the aggregate and social determinants. We're not looking at trends over time in what happens when more girls get educated. We're not looking at trends over times when poverty rates go down. We're looking at which girls in particular households are getting married, which girls are less educated. We're not looking at it as an aggregate. We're also not looking at the normative effects of education. We're looking at only sort of this correlated relationship. We're not looking at what is education doing in terms of how people think of girls. When many girls are getting educated, do people think of girls as children instead of marriageable adults? And that's not well studied. And we also are not studying enough the job opportunities for young women and what that means as role models for younger girls not getting married. Next slide. So what are our recommendations on research for drivers going forward? Our first conclusion would be we know more than enough in most cases, and we should stop doing more studies just because we think we have a lot more to learn. But instead, we should be pushing the experts who are really good at doing these studies to answer some of the key remaining questions rather than doing broad driver studies. We should consult the rich literature that already exists instead of doing more studies of our own. And we should start looking at the big picture factors rather than the small nuances, because what are the big changes that are happening in districts, states, countries that are associated with big changes in child marriage rates? I think those are the focus needs to shift. Next slide. On consequences, trends, and coverage, you can see also that the research has gone up very dramatically, and it shows the same patterns as prevalence. Next slide. We see that there's a lot of progress on the data and research we have on the negative consequences for married girls with regard to their sexual, reproductive, and maternal health, on the personal impact, especially on gender-based violence, on their autonomy, on their education, on their marital satisfaction. We are now starting to question the HIV link with child marriage, which was established earlier. People are starting to explore the impact on mental health and nutrition of girls. And we are also have a confirmation of the consequences for children of married girls and their survival and health being questioned. And there are some studies on what happens to societies and nations because of child marriage, economic impact on countries. Next slide. But their gaps and challenges are again now few because we have made so much progress on this front. We still don't know what it means for girls over the long term of having married, what means in terms of do those marriages last, what are their options for divorce, more or less than girls who married later. We also have limited impact on what child marriage does for women's economic options themselves. Are they less able to enter the labor force? Are they more forced to earn money because they're more likely to be poor? And similarly for their children's long-term status. And on societies and nations, we have measured a lot the economic impact, but we're not measuring what happens when child marriage rates go down. How are societies better? Are gender norms change when child marriage rates go down? Are women more likely to be in the labor force when child marriage rates go down? Things like that we don't have good data on. Next slide. So what would be our recommendations on consequences? We should be clear about why we want to keep establishing negative consequences of child marriage. If we're using consequences to sell the issue and get policy commitment, which may be just good PR for a lot of politicians who make the commitment? Or are we taking concrete action to mitigate the negative effects for the girls who are getting married? We should be also careful about, again, not piling on unnecessary negative consequences. Recently, I got a paper to review where people had looked at, does tobacco use go up because of child marriage? And, less than 2% of women who are married as children are even exposed to tobacco use. And I kept thinking, now, why do we need to know this information? And there's no justification. Now, it may be important, maybe the authors had a good reason, but there's this tendency to just keep saying, oh, these are all the more negative things that happen because of child marriage. And I'm not sure we gain anything. Again, the consequences of child marriage are bad enough that I'm not sure we need to keep piling on, and we may lose credibility. Next slide. So finally, on intervention research, as you can see, that also has increased, but if you look at the numbers of studies, they're much lower than for the other types of research that has been done on child marriage. We're not talking in the hundreds anymore. We are talking in just lower double digits. And that's I think, a matter of real concern. We have been doing research more on understanding child marriage and less on what we are doing about it. Next slide. And on the research on intervention, we saw that there were 7 studies on mapping programs and implementation, which is probably the area that's the weakest on intervention research. There are hundreds of child marriage programs out there right now, and we just don't know how many there are. Nobody is counting them. And where are they? Most of them are run by NGOs, aren't not at scale, are not evaluated. And there's little research that is documenting what are the challenges that NGOs are facing in implementing these programs. How are they going about it? What funding do they have? What scope do these programs have for scale up and so forth? We don't have a good understanding of that, and that's desperately needed, I think. We also saw evidence review of intervention evaluations of child marriage prevention. There were 4 reviews, 3 of which were systematic. It's also now becoming part of other topic reviews, so not just a systematic review on child marriage, but a systematic review on health is starting to incorporate evidence on child marriage interventions, but a lot of it doesn't tell us very clear answers of what does it mean, what have we learned. And lastly, there are very few evaluations of mitigation of child marriage. We have more literature on what is being done to prevent child marriage than what is being done to address the needs of married girls. And that definitely needs more work. Next slide. So I'm not going to repeat too much, but as you know, that last time Shatha and I presented findings from the paper that we have published on our systematic review in Journal of Adolescent Health, where we updated and looked at all the evidence on prevention of child marriage in the last 20 years. And we had some pretty stark findings. We found that of the 11 multi-component approaches that were trying to empower girls, only 3 showed positive findings, and in only 6 of those 11 studies were of good, medium, or high quality, and only 1 of those medium or high quality studies had positive findings. In contrast, we saw that there were 11 studies on conditional cash transfers that were aimed at keeping girls in school or helping them to go to the next grade. And out of those, 8 of them showed positive findings. And out of the 11 studies, 10 were medium and high quality. So 8 out of 10 studies on supporting girls with cash or kind transfer to stay in school showed positive results, which was a very strong result. And then we had fewer studies on women's job opportunities and livelihood skills training. There were only 3, but all 3 showed positive results and all 3 were high quality. Similarly, there were 3 studies on just by itself gender rights and life skills training, and 2 out of 3 showed positive findings, and all 3 were high quality. So on the whole, we found that multi-component programs, which is what most programs are doing, do not work very well. In contrast, conditional cash transfers for keeping girls in school, or programs that are trying to improve girls' job opportunities and skills, are much more likely to be effective. Next slide. So our conclusion from our systematic review of intervention evaluations is that single component interventions were much more likely to be at scale and sustained than multi-component programs. And that was another element that we added to our systematic review. We didn't just look at whether programs were effective, but whether they were at scale and were they maintained over time, or were they single time event programs. And single component like cash transfers or like economic opportunity or skills were much more likely to be at scale and sustained than programs that were multi-component. We want to emphasize that programs on child marriage really need to look at scale, which is currently they're not doing. We need to be reaching conservatively, let's say in a country like Zambia, at least 125,000 girls, which is a small country if we're going to reach the target for child marriage reduction. In Bangladesh, we would have to reach over 2 million girls, where 9 million girls are at risk. And I'm talking about, this is just if we wanted to prevent child marriage for 25% of the girls at risk, not 100%. And the typical multi-component intervention reaches only 5,000 girls. So the current approach is not working, and we need to really shift gears. The repeated challenge for many multi-components program is that they do not have the full rollout or the uptake. So it's not just that they don't work, but they're hard to do because NGOs don't have the capacity or the money to do all the things that they plan to do. The intervention time is usually over by the time they even start doing half of those things. And many of the people that they're targeting the interventions for don't have time to do all the things, are not interested in doing all the things that the NGOs are trying to do. And many of these programs have very elaborate, very ambitious theories of change for transforming gender relations, but they have fairly little money, little time, and few interventions and a few people that they're doing it with. So it seems a little bit overly optimistic, and we need to really rethink many of these strategies. Next slide. So my summary on the progress and gap in 20 years of the evolution of the literature would be, there are more robust measures, better tracking of rates and burden, and we should be careful about assumption-based models. Second, there's an explosion of research on drivers and consequences, and so we should be much more miserly about more research in those areas and be very, very picky. Third, the evidence is still aimed mostly at advocacy and less at programs at scale. So it felt to us from looking at the review that many more studies are being done to show people that child marriage is a problem, rather than studies being done to show how to solve the problem. And really, because we are now a mature field, child marriage is already on the global agenda, we should be thinking about, should we be doing studies just for advocacy, or should we be doing studies to help us solve the problem? And last but not least, we felt that many of our cherished ideas about what works are not validated. So we need to reconfigure our thinking and our activities in terms of what we are doing. And then my last slide, next slide. So some food for that thought: how can civil societies and research be more innovative about their role and influence in making a difference at scale? And some of the questions I would suggest we think about is, how useful is it to focus on influencing policy commitments that a lot of governments and policymakers are making, but then they don't give them adequate resources and follow through? Do we want to keep going down that road? Or what are the alternatives for civil society that to running these small programs that they themselves are running without the capacity and the resources and the impact that they would like to have? How might civil society actors change their role and be more creative in having more influence than they currently have? And I think those are some things that it would be great to think about together. Thank you very much.
Thank you. That was really interesting. Can I jump in with a couple questions?
Absolutely. And there's one last slide, Rachel. So just click. Yes. Okay.
I'm actually going to go back because I think that these, if that's okay, I think these are really good things for us to come back to. And I want to go into these food for thought questions in a second. But first, I just have a question about your findings on intervention evidence, because it seems counterintuitive to me that a cash transfer itself would be really beneficial, but a cash transfer with other interventions layered on top, a multi-component intervention, would not be. Is this, do you think, because of implementation issues, or I'm just sort of curious, because in other fields like HIV, they're really pushing a cash plus care model where you need both components, where one component is not enough. You need both to really reduce HIV risk for adolescent girls. So I find this really interesting that those multi-components are not effective and that the cash alone has been in this field.
Yeah. So I think that, so first of all, let me just be very, very clear. Cash transfers, we looked at in our analysis 3 different types of cash transfer models. So because many of the people who are working on this area are not economists, they don't necessarily differentiate the many different kinds of cash transfers that can exist. So cash transfer programs that are unconditional. There are many of the cash transfer programs in Africa in particular are unconditional. We found they had no effect on child marriage whatsoever. So interestingly, just reducing poverty for the family and mitigating poverty is not necessarily helping girls, because the money may or may not go to benefit girls. The money may or may not help them help prevent child marriage. We did not find any effect. Similarly, there are cash transfers being done to incentivize parents not to marry daughters. So, Annabella Rolker has done several programs in East and Southern Africa where, parents and girls get either cash or in kind if they stay unmarried till 18. And those programs show a mixed effect. Sometimes they work and sometimes they don't work. Sometimes they work for younger ages and sometimes they don't work for older ages and so forth. So there's a mixed effect. What we are showing in our study is that cash transfers that are aimed at keeping girls in school, and keeping girls in school, especially at higher grades, secondary school, work pretty much consistently. And many of these were programs that governments were running and not NGOs. And so they were at scale, where the Bangladesh program, the Pakistan program, the Mexico program, one after the other, you had large scale government commitments to saying, okay, if you go on to the next grade, if you stay in school 80% of the time, we will keep paying your fees, or we will give you, your uniform, or we'll pay for your books, or so forth. where you're investing in the girl's human capital, then it seems to prevent child marriage. And that's perfectly logical, because we know that there's this massive relationship between staying in school and not getting married. So it makes a lot of logical sense. Multi-component programs, especially the ones that try to do 4, 5, 6, 7 things, they do not work. Partially because they have so many things that they're trying to achieve, and there's just not money or capacity to achieve all of them. And then also what we find is that the effort gets diluted and the uptake is low. A lot of times parents really are not interested. Fathers are not going to show up to community mobilization programs. Mothers show up for a while, but then after that, they have things to do. Girls keep showing up, but then, they get very motivated and interested in the ideas, but have no place to implement that because their life situation hasn't changed. So that's the logic for multi-component programs not working. Your point with the HIV, the Cash Plus, we don't know yet if very targeted Cash Plus programs that are not trying to do everything, but that are doing, let's say, a cash program where you're supporting somebody for something. And again, the HIV programs for women in particular, when we are talking about cash, you're talking about economic support. For girls, it's not clear whether it's cash for economic support that would help, but it's very clear that cash for staying in school helps. Now, if you do things in addition to it, it might have an additional effect, but in our study, we didn't have any such programs. So it is something yet to be tried. It's possible it works, but also it's possible that it doesn't work precisely because you actually may not need to do everything through a program. There are some things that are more likely to catalyze other things because families become more empowered, because girls have opportunity, and they're likely to demand these other things. And in places that are very deprived, sometimes doing anything will be better than doing a lot. So there are lots of reasons to be worried about multi-component programs. And I think the biggest reason is, are you going to be able to take it to scale and keep it up because the money required is larger?
Just a very quick follow-up, but then I'll let others. There was only one study of removing school fees, I think, in your review.
Mm-hmm.
But I find it interesting that that was not effective, and yet direct transfers to girls were. Or was that a primary school fee issue?
So yeah, that was primary school. And also, by the way, it was one study, but it was a macro level study of many countries. And it showed mixed effects. So it's not effective because it was not consistently effective in all countries. But in some countries, removing primary school fees was effective. In many countries, it was not. But primary school, and they were all African countries. So we're talking about countries that probably should have removed primary school fees a long time ago, but took a while to do that. So yeah, we're talking about primary school in Africa only.
Yeah, hi Anju, Sushmita this side. So Anju, I would like to a little bit more talk about the second question that is on the slide about policy commitments. Did you see what are your opinions and thoughts about multi-departmental government agencies coming together? What happens, for example, coming from an Indian experience, the education sector policies doesn't speak to the women and child development sector policies, or maybe doesn't speak to the Ministry of Home Affairs and all those things. And because these things don't speak to each other, so interventions on ground actually stumble upon, they keep on advocating one to another. That's my first question. So has there been any opinion, thoughts, or any experience about governmental engagement?
Yeah, so I think that's where we need to start focusing, right? And what has happened is that one of the biggest damages that I think the multi-component, and I feel bad because I'm guilty of, in many ways, having fostered. And Sushmita, you know that when we were doing Disha and other programs, in the 2000s, we were all on the train for multi-component. We were emphasizing these. And even when we published this 2011 systematic review, when we listed 5 different strategies for addressing child marriage, our recommendation was for people to choose from amongst them, depending on what would work in their context. But instead, people took it as, we need to do all of these things. But the biggest, I think, challenge is precisely that child marriage usually doesn't have one ministry that it belongs to. And even if it does, it's usually the youth ministry, or it's the women's welfare ministry, or the gender ministry. And that's usually the absolute weakest ministry, without any influence, without any power, without any money, without any budget. And so the education ministry doesn't really own child marriage as their result. The health ministry doesn't really own child marriage as their result. Certainly the labor or the economic growth ministry does not own child marriage as their result. And then the poor child marriage advocates end up having to keep advocating with all of these ministries, and the best they ever get are little crumbs here and there of resources or attention, and it's just hugely exhausting for them, because, as you also know, Sushmita, ministers come and go, politicians and IAS officers come and go, and just when you got finally influence one person, somebody else in the other ministry moves. So it's a real challenge. And my thinking from some of the analysis we have been doing is that instead of sort of trying to coordinate across this ministry, and there's a very good paper that Chandramouli and his colleagues have published on the Indian experience of trying to coordinate with Mamta on across ministry, and just like an utter failure, it just did not succeed, is that we need to target at the district level the ministry that we think has the most potential for doing good to our goal. And almost most likely there you have 3 to choose from. Education, first and foremost, education, because it's like the golden path. Educated girls don't get married early. So we need to find that path. The second ministry would be whichever ministry is implementing social protection programs, and really help them structure those programs very well. And then the third ministry would be health, provision of family planning, provision of nutrition for girls. Where are adolescent girls in that health agenda? And my recommendation was that you pick the one in that district that's going to really help you get something done, get real resources, get real action for the girls. And with the education ministry, the challenge is going to be that almost all education ministries will say, of course, we are already telling you we're educating girls. Aren't we committed to educating girls? Everybody's committed to educating girls. And that's where we need to be very precise about what we want them to do differently or better. And that's not what we're doing. That's not where we're focusing on. Like, what is it? Should they have more female teachers? Should they have more female teachers from that district so that there is a motivation for parents to be keeping it? Should they be coordinating with looking at what the labor supply in different jobs is going to be so that they can target particular girls into going into certain fields? I mean, those very precise things. Aren't they even monitoring the relationship between child marriage and education as an education indicator? There's so many very specific things that we can be asking the ministries to do instead of just saying, can you please have child marriage on your agenda?
Yeah, thanks. maybe I can ask another question, which is more about programming side. Nowadays, there is a lot of talk about SBCC, behavior change communication, norm shifting. Is the project looking from the norm shifting angle? It would be great to learn from that. In last 20 years, did you see any of this thinking there, or the thinking has changed? Are they new? Are they coming back as the history repeats?
Yeah, so we're doing, as you know, that I've been doing some work on this norm issue, and again, I worry that the direction we have gone on norms in the last 10 years is not good, because it's a sort of a cop-out where, because ministries and NGOs can't do serious, concrete things for girls, like, get them real money, get them real schooling, get them real jobs, that we keep talking about everybody. It's just like it's easy for ministries to shove off their responsibility on child marriage to another ministry. I think the norms discourse lets everybody shove off real concrete progress onto some vague social change idea. And we are using behavioral change interventions way too much to think that we can change people's circumstances. And sometimes, it does help to change people's thinking. Yes, we do want people to think differently about girls. But how much does a norm, quote unquote, norm change program, which is usually some kind of an IEC campaign or social media campaign or media campaign, right? It's usually telling people new ideas, different ideas, more progressive ideas, more empowering ideas. I think we should be questioning those strategies, because I see very little evidence that is showing that we achieve very big results from them in terms of behavior. First of all, the behavioral outcomes are very limited. Attitudinal outcomes do change, but we don't know if they change for the long term. They usually change in your intervention period, but after you're gone, do people maintain those ideas, or do they go back to thinking the way they were? Because your intervention's gone, but everything else around them is the same, right? So they are, like, for the one social media campaign we do, telling boys or girls to think differently, think about all the other social media that they're getting that is telling them, that's reinforcing very gender inequitable ideas. They're bombarded by Bollywood or by Hollywood and so many other interactions that are not so progressive. Are these things changing norms? And I was very struck by your comment last time, Sushmita, where you said, we are empowering the girls, but then they are not able to enact those empowerment principles in their lives. And that makes perfect sense to me, because their real life situation hasn't changed. So I'm more personally a believer of changing people's real life situation, which I think will change their thinking. And I think the more people whose real life situation changes, the more norms change, because collectively people think differently. I worry a little bit about imposing our thoughts on people's thinking when we can't give them the power to change their life circumstances.
Great. Thanks, Anju. Over to Rachel. Rachel, I'm just conscious of time as well.
So we are at the end of the hour. Is there any last burning question or thoughts from folks on the call? All right, if not, thank you very much for a wonderful presentation, and particularly for those insights and different ways of thinking about intervention and what we should do to bring some of this to scale. I was really struck by some of the even those numbers that you presented about, small scale programs, multi-component programs, reaching 5,000 girls when we really need to reach 2.5 million girls to have a real impact. So thank you for bringing some of this into a more realistic picture. I certainly have a lot to think about going forward. I really enjoyed having you. Thank you all.
Thank you very much. Thank you for
Thank you.
having me. All right, bye-bye.
Bye.
Thank you so much. Bye-bye, everyone.
Bye. Take care. Bye.
Bye.
Thank you so much. Bye bye.